Hello, I'm Dr. Janette Nesheiwat, and I'm here with Lloyd Bailey. He is the administrator of the new Benton County Health Department. Lloyd, thanks for joining us for today.
Oh, you're very welcome.
Tell us, what is the meaning of this new facility here in Benton County?
Well, I think one of the things that it initially does for us, it gives us more room, more space, and I think it'll be much more, it'll be better for our clients and better for our staff both.
How do you think it'll affect our community as a whole?
Well, I think it will allow us to perhaps do a little more partnering. We've always, I thought, done a good job with partnering with some of our associates in the community. And I think with some of them being housed in the same facility, that could maybe even take us a little step further.
Can you tell us what goes on here?
A lot with public health. We are a primary provider of immunizations. We also have provide family planning services. We are the provider of WIC services in the state of Arkansas, which is the Women, Infants, and Children's Program. We also provide STD and TB services and administer that program. We also have one of the largest, if not the largest, environmental health program in the state. That program has responsibility over food service inspections, new on-site sewage disposal systems, septic systems, and some other things as well.
And who is this facility intended to assist? Anyone?
Anyone. There are some programs that we administer that have income eligibility criteria, and but by and large, many of our programs are accessible to anyone.
Why did this facility open versus the old facility?
Well, one of the things that was a known was that we were needing more room, more space. In our former site, we were able to do a pretty extensive remodel back in 2000, and we knew then that that was probably going to be about a 5-year, give us about 5 years before we were going to have to reassess. We were able to get 10 years out of that. So there again, the need for more room, more space was a known, and things just kind of fell into place, and we were located here. Very
good. What would you say is the greatest benefit of this new, amazing, beautiful facility?
Besides the immediate additional room, I think the partnering aspect, which we're just now, really finding out about the power of, as far as having several entities in one location. We're anxious to really delve into that and see what that's going to allow us to do in the future.
Very good. And what are some of the other organizations that are here in this building?
Well, we have the community clinic is located in this building, and we also have some other entities that we're just now finding out about. We had a luncheon just recently with some of the other representatives of the other agencies here, and that's going to be an ongoing event.
Very good.
And so I think that we're going to be able to build on that and learn more about each other.
Excellent. What is your ultimate goal and mission here as administrator in this new facility?
Well, basically keep everything between the ditches and go in the right direction. But we've got a lot of good support, county government and the county community in general are tremendous supporters, always have been in Benton County, and we will just want to continue to build on that.
Sure, and we are so fortunate and lucky to have these resources here in our community. How about a tour of the facility?
Super.
All right, so let's check it out.
This is our Women, Infants, and Children's, or our WIC receiving window. So people that have met eligibility requirements for that program would be coming over here, and we can pretty much streamline that process. Our windows on the other side of the lobby will have intake for our immunizations, family planning, STD, TB, all that'll take place over there. So this really, we have found it at our previous location. We segregated these two programs and flows over there as well, and we found that the public really liked that, and also it was more efficient for us.
Wow, this is a huge room. What goes on here?
Well, this is a dual-use room too, and again, it's borrowed from what we did at our previous location. A lot of time is spent in this room with what we call second nutritional ed. It's a required component of our WIC program. So one of the key elements of the WIC program is for pregnant and postpartum women and kids, infants and children up to the age of 5 that are income eligible and meet other requirements, for them to get what we call food packages, which can be made up of formula or certain food staples, milk, cheese, beans. One of the required components is that they attend a nutritional education class. So this is utilized for that purpose, and we have quite a few in our classes.
And for those who don't know, what does WIC stand for?
Women, Infants, and Children. It's a federal program that's administered by the states, and in Arkansas, the Department of Health is the administrator of that program. It's also used as multi-purpose room. If we want to have an evening workshop or some type of a large staff meeting, we can utilize this room.
Okay.
One of our immunization rooms, I don't know if y'all want to get into this detail, but we have our storage refrigerators, and so our clients there again that come in for WIC and immunization services, we can expedite, providing them their services by just moving them right through this hallway.
Now, immunizations are free of charge here at the health department?
There is a records maintenance fee, $5.
$5.
Records
All right,
maintenance
fair
fee.
enough.
This is our nurses station right here.
All right.
Which we can stage some of our nursing personnel in.
Yeah, that'll be nice.
This is our women's health hallway.
Wow, this is absolutely wonderful,
Family planning,
huge.
maternity.
Very spacious.
These services occur through this hallway. You'll notice some of the rooms, or the room size is a little larger. And what we did, we kept, with the former rooms, we did keep the restroom component. We kept that active, which is a real plus for our clients.
And that's because this was once a hospital, correct? And these were once hospital rooms, and this building was donated to the Jones Trust, which is absolutely amazing and fantastic.
And this was the labor delivery floor. And we do have a nurse practitioner that's not full-time with us, but she does have to share time with our clinic over in Siloam Springs.
What would you say is the most common service that you provide here at the health department?
Probably immunizations.
Immunizations,
and
sure.
We also provide a lot of the TB skin testing. This is a nursing station, which between this station here and the one that we previously saw up at the front of the hallway, that's where our primary housing is for our nursing staff. This is our break room area. Our former site wasn't large enough to get any appreciable number of our staff in the break room at any one particular time, much less when we rotate them through. So this is much more spacious than we had before.
Is funding for this health department all from the state, federal funding?
County.
County, okay.
It's a very interesting arrangement. In Arkansas, the counties provide the facility, much if not the bulk of the maintenance and operation monies. The state provides personnel. This is our conference room, multi-function room. We do have a lot of video conferences within our department. We do have occasion outside the department to also be able to video conference, and we're really hoping to be able to build on that, because there's just so many opportunities to get good information and have some dialogue on certain health topics that we're really wanting to tap into that.
Lloyd, what prompted the move to this new facility?
Well, I know that the county was looking at a couple, if not 2 or 3 locations, and as discussion went along, it was felt like this was the most logical site, and I believe that's what prompted the Quorum Court to look at moving to this location.
So size was a factor and availability, would you say?
And I think there was some discussion about location. Not only would we be in the same site with some other providers, but we would be on the transit route, and there again we're probably a more denser populated area.
So I guess would say a growing need as well.
Right.
All right. Well, this is just an absolutely amazing facility. Thank you so much
for coming.
Giving us a tour, and I know it'll be a great benefit to all of the citizens in our community.
No doubt.
Thank you, Loy.
Thank you very much.
All right.
Appreciate it.